campaign by the city mayor of Douala has been launched today. The newsroom will throw more light on how urbanization in Douala will be carried out, and a press conference today on tradic practitioners who are picking up the burden to contribute for the fight against the COVID-19 pandemic, and growing concerns over the increase in the number of cases cannot be avoided even as government is fine-tuning tactics on how to curb the spread of the COVID-19 virus. Those are top stories. Good evening, ladies and gentlemen. Thanks for joining us on the 6 p.m. newscast on Spectrum Television. I am Josephine Bindzi. Traditional practitioners in Cameroon have proposed solutions to help fight against the coronavirus in Cameroon. They held a press conference today in Douala to present their proposed solutions to the global pandemic. John Paul Sama was in attendance and files the following report.
Tradic practitioners in Cameroon have taken it upon themselves to respond to the call from the head of state on a mobilization against the coronavirus, as they are totally engaged in the fight against this global pandemic. They are proposing certain treatment protocols for this disease, which they say is made purely out of plants.
We've come just to let people understand, when there's a war, people have to join their efforts. Last day, we've noticed exactly what has happened to Malagasy area there. They took the Artemisia. People were saying that there's nothing which is going to be used. By the way going then, they asked us some prescriptions in such a way that from Yaoundé, we could waste a lot of time. The president last day said, we need an inner mind prescription and then something which is coming from ourselves, then we do something. That's why we decided, just as far as helping people is concerned, we've already done, all of us have been doing certain type of things. Beyond then, we are more than 200 persons that have been killed. They find themselves in good conditions. That's why we call you, just to let people understand exactly how far we've gone and what we can even keep on doing just to try to save mankind.
The Association of Health Tradic Practitioners in Cameroon say their motivation is in line with their zeal to help save mankind and contribute their own quota to the well-being of Cameroonians, even though their herbal mixtures are not scientifically tested and proven.
Given that beer parlors are the most popular joints, the Delegation of Public Health has sensitized bar owners on preventive measures, even as Cameroonians have warmly welcomed the uplift of barrier measures. Peter Nsosier has details.
The reopening of bars in the country following the easing of measures by government continues to generate mixed reactions, as some people ascribe the increasing prevalence rate of the coronavirus to laissez-faire in these areas, with the non-respect of barrier measures gaining steam. The Regional Delegation of Public Health for the Littoral region is taking the responsibility to sensitize bar owners on the repercussions should they continue with complacency. We thought that it was important for bar owners to be sensitized on the risk of contamination in their place of work. At a forum in Douala Wednesday, the bar owners were schooled on the mode of transmission and preventive methods against the coronavirus pandemic. The wearing of face masks is important. We should not sell to those without it, and we should also wear it in order not to contaminate our clients. Participants appreciate the move of the Public Health Delegation, highlighting that it is timely. This is laudable because it permits us to protect ourselves and our clients who regularly come to our bars. The Regional Delegation of Public Health for the Littoral region has announced a massive sensitization of bar owners in the city of Douala to enable them roll back the pandemic.
Over to the South region, the Kribi Fish Market, which plays host to hundreds of persons daily and thousands before the outbreak of the coronavirus, is set to be plummeting in sales. The number of visitors today have drastically reduced, with most complaining of the non-respect of preventive measures. John Paul Sama.
About 1,500 tourists usually visit the Kribi Fish Market before the outbreak of the coronavirus. These days, that number has drastically reduced, with the place mostly visited by locals doing business and others from around the country.
Nous avons vu le taux de fréquentation baisser.
We have seen an over 70% reduction in visitors, and you should understand that it is going to have a direct impact on commercial activities. We have a good number of restaurants who have shut their doors as a result of this. We are also witnessing great losses because over 40% of our clients are from out of the region.
Parce qu'il faut avouer que 40% de nos clients.
Les activités économiques plongent.
Economic activities are slow in Kribi, especially here at the fish market. We don't have enough clients who come to buy fish, and this affects us negatively.
Ça se répercute directement dans les blocs restaurants.
The few customers who brave the odds to stop by complain of the non-respect of barrier measures against the coronavirus in some parts of the popular fish market.
Je dirais non, vraiment.
Here in Kribi, people are not conscious of the COVID-19 because they don't respect barrier measures. Look around us, people aren't wearing masks, and there's no water and soap to wash hands, not even hand sanitizer.
On ne peut pas se laver les mains ni se désinfecter.
The measures which the government has put in place is not respected here. Those in charge here, however, say with the hustle and bustle which characterizes this zone, those preventive measures are hard to follow.
Bref, nous avons quand même pris des mesures au niveau du site.
We have taken some measures to ensure that the prescribed rules proposed by the government is respected, like the multiplication of hand-washing points, wearing a face mask, as well as the respect of social distancing. But there is a lot of worries at this level because, you know, fish here is like diamond, which attracts a lot of persons, and sometimes they forget to follow these rules. Some traders, on their part, are trying their best to adhere. We wear a face mask, but at times it's really hot, and that's why I put mine in my back because I have difficulties in breathing. They are, however, hoping that with a little time and sensitization, these measures will be respected to the latter by all and sundry in Kribi.
Coronavirus-related risks are not covered by insurance companies in Cameroon. Experts say the situation of the pandemic is the reason. Peter Nsosier has more.
Insurance companies in Cameroon will not cover risk related to the coronavirus. According to experts, this is because of the global situation of the health threat. There is a transfer of risk from the insurer to the state. This is why the Minister of Public Health has always said that COVID-19 treatment is free. So the insurer does not take the risk of COVID-19 because it is incurred by the state, as it has been declared a pandemic by the World Health Organization. The exclusion of pandemics from covered risk is also improved by a halt in medical evacuations, which constitutes a large chunk of insurance expenditure. Several stages are involved. The client is the first stage. The insurer also has a cover from his reinsurer, who has made it clear that there is respect of regulations, since there is a transfer of competencies to the state. The coronavirus will not adversely impact the insurance sector in Cameroon, as stated by Proter Ayagma, an insurance expert. Transport, travel and car insurances could be impacted more or less significantly.
Talking about Cameroonians living in the UK, the United Kingdom is the leading European country with COVID-19 death chart with over 30,000 deceased. The government this week has eased barrier measures, but life is still a nightmare for Cameroonians who reside there. Peter Associate speaks with a Cameroonian based in the UK, and she tells us her ordeals.
Efforts by the United Kingdom to contain the coronavirus, which has killed more than 32,000 people, have drastically changed routines for many, including Cameroonians over there. Nkengmenyi Emilia is a Cameroon Chevening scholar at the University of Leicester. She reveals that life has never been the same since the government imposed lockdown.
Everything has come to a standstill. You can't travel as much as you can't go out. You're just trying to make sure you stay home and then you stay safe.
Her academics have also taken a hit, but reforms have been made to deal with the times.
Because since March, all teachings and on-site activities have been moved online. So we don't have any physical contact with lecturers and fellow students. And all written examinations were also cancelled, but the university try to put in place other forms of evaluation so that students don't miss the semester.
In a country where she is still learning to stand on her feet, Emilia is finding solace from the warmth of loved ones.
But I think their support this far is still very, very great, because I receive several calls daily from friends calling to check up on me, how I'm doing. I receive messages all over social media trying to encourage me and making sure that I am staying safe.
British Prime Minister Boris Johnson, who survived the pandemic, has ushered new lockdown guidelines that went into effect on Wednesday. But these easing measures do not call for complacency.
I think there's a general call for everyone to come together so that we can fight and make sure that we beat this disease. So please, stay safe and make sure that you're taking as much precaution as possible, because if you protect yourself, you protect everyone around you.
Like Emilia, others are also hoping the pandemic is neutralized so life can return to normal in the UK.
Public and private enterprises are joining the fight against the increased number of COVID-19 cases. Though government has eased measures, John Paul Summers says the battle against the COVID-19 in these sectors is still on.
In most or even all offices here in Douala, washing and sanitizing of hands is the order of the day for staff and clients.
As far as the subcontracting and partnership agencies of Cameroon is concerned, we have urged our personnel to respect the 13 measures that have been put in place by the government and the World Health Organization. And also, as you saw when you're coming in, we have a solution that any visitor and even any worker of SPS should respect before coming in. So you have to use this solution in order to disinfect your hands before coming in.
We have for a good number of days now water and soap for people to wash their hands, which applies to everyone who comes to this office. To also ensure that they limit contact in the office, some have reduced the number of staff in a given area.
For now, we are just we have less than 20 members of the staff working here. So all the members are, for now, obliged to come to the office. But those who believe that they can work at home can ask that to the director and obtain the allowance to work at home.
Our commercial and administrative staff are in a total lockdown. We are only here because we have to be on standby to attend to the number of people that come in here for our services. For now, precaution is the order of the day in public offices in the city of Douala, as Cameroon and the world put in place measures to combat this pandemic.
Beauty and artistic work seems to suffer huge lapses, given the wearing of face masks and makeup, which are two parallel lines. Catherine Kone sought to know how these sectors are coping and has this report.
The glory days of beauty and makeup parlors have gone sour as clients have to substitute face masks for makeup.
Dealing with makeup and putting on face mask now is really difficult because face mask generates heat and the heat does not go with makeup. So for now, we literally don't wear makeup, or we wear a no makeup. So that's what happens now.
To her, the beauty industry has lost its value as the sales and bookings of clients for makeup has declined.
Coronavirus has affected my business a lot. So there is no longer flow of income. So people who book for wedding, they have cancelled. There are no longer ceremonies, no going out, self-confinement, and so many other things that are making the business to be slow because nobody wants to come and do makeup. A face mask that is going to make the makeup to melt. So it's really difficult for people to cope with the coronavirus and business.
Though the demand for makeup has reduced, the purchasing price for makeup equipment have become more expensive.
The demand for makeup products have reduced. Clients no longer buy makeup products, and all those are a source of income. The prices of makeup products have inflated. These are 2 times initial price, so it makes business to be difficult, and I think it's better to be confined in the house than coming to the shop and ending up selling nothing.
As the compulsory wearing of face masks still stands as spelled out by the government, the beauty sector continues to suffer the severe effect due to the global pandemic.
The rise in the number of COVID-19 cases is a growing concern for Cameroonians, especially those who have children in examination classes. The newsroom went out to find out their opinions, and we put forth this report. The rise in the number of cases on Cameroon soil has relayed wrong signals to Cameroonians, especially going by Manauda Malashi's tweets on Cameroon entering a complicated phase.
For me, it causes more fear because there you take people there, you meet people and so on and so forth. So it makes a lot of fear in me. So I myself, I for one, I don't attend bars. I don't go to bars because I'm afraid of corona. Even as I'm walking like this, I don't want something that can bring me some ill health tomorrow that I might go house. I don't know how to control the virus. So I can go home, my children will be infected, that kind of stuff. So I'm in a kind of a way, I know how to present myself.
Some parents are highly concerned on the reopening of schools as they seek a strong guarantee from government on the health security of their children.
With the
rate at which the numbers are increasing, I don't think my daughter, who is in an examination class, can go to school. They should lay down the necessary strategies so that they are not infected in school and spread it at home. They plead on government to intensify measures ahead of June 1. They should do all that is possible for kids not to be infected and spread it in an uncontrollable way. Others relentlessly are still on the alert as they combat the viral spread with preventive measures.
Everywhere I reach, I meet even a bowl of water, I wash my hands. After washing my hands, I sanitize my hand before going. And when I reach my house, immediately I'm entering my house, I go straight to the bathroom. I bathe the dresses I put on that day. I have to preserve them somewhere for washing before I even go closer to my children.
The economic capital is Cameroon's most infected city, but records more deaths. It is therefore imperative for the war against the blind enemy to intensify. The city mayor of Douala, Roger Mbassandine, has launched a campaign to regularize construction permits as well as their verification in order to ensure that the city of Douala respects urbanization guidelines. John Paul Sama with details.
Haphazard construction of houses is the order of the day in Douala, with houses built without the respect of planned urbanization. And in a bid to ensure that the city of Douala respects the rules of urbanization as well as the guidelines, the Douala City Council has organized 2 campaigns on the regularization of construction permits as well as the verification on their conformity. A campaign which began this Wednesday morning to run for 3 months. All inhabitants of Douala and landowners are concerned by this campaign, because when the construction work is about to take place, a permit is required. So this is going to facilitate the process for those who have not yet had it and to regularize the situation for others. This caravan is expected to go around the city of Douala from Banga Bakoko, where it began today. Its next stop is going to be the industrial zone of Bonaberi. From there, it will be the turn of the port zone, Maitu, and all the divisions in the city. The documents required for an urbanization certificate for this campaign, which consists of about 5 elements, is available at the Douala City Council and points to be opened around the city of Douala.
On our international page, New York City is famous for its packed streets and subways. The city is now living through its transportation detox due to the coronavirus pandemic. COVID-19 has caused a true bike boom in the city as thousands of Big Apple residents swap their cars and subways for 2 wheels. Details with the VOA.
New York City streets pre-coronavirus were places where bikes had to share the road with cars and cabs. But because of present conditions, bikes have taken over Manhattan avenues and demand for them has been increasing.
We got big clientele. We used to work in different shops, but we see new faces. People started riding more to, commuting. Yeah, I see that more. People started taking out the bikes out of the basements. That's good. So they can less traffic in the trains and less people in the closer. So they have it socialized distance,
Bikes are an attractive means of transport for many reasons. The cost, there is no problem with parking, and New York City has loads of bike repair shops. Those who still use the subway see ads encouraging them to respect social distancing rules. That's easy though, because trains are mostly empty due to the mandatory lockdowns and businesses shifting to teleworking.
I'm a tiny bit more relaxed, but I'm still very careful because I know that we can't let our guard down. Even though I'm not wearing my mask right now, you'll notice.
I just walk. I don't take the subway anymore. So I just walk around my neighborhood. I walked here today from 91st Street. So.
Yeah, for sure. I haven't been in the subway since March 13th, March 13th.
As for the recent bike craze, it didn't happen overnight. It took people time to consider whether they even wanted to venture outside.
I feel like everyone was just kind of scared and staying indoors. Like the end of April is when things really started to pick up. People want to avoid public transportation. It's a lot safer to go on a bike. And then also it's helped that the gyms are closed. So this is the only way that people can get, exercise.
And for frontline workers such as doctors and nurses, it's a less costly way for them to get to their jobs.
We have some nurses from out of states, so they've been using the bikes, which is great, and we're also providing them big discounts, so it helps them, it helps us.
If this bike trend sticks, Manhattan may never fully go back to transportation the way it was pre-coronavirus. For Evgeny Maslov in New York, Anna Rice, VOA News.
Thanks for watching the 6 p.m. newscast on Spectrum Television. Stay safe as we fight the COVID-19 measures together. Good night.